we do need more studies in order to truly prove efficacy in these patient populations. But our interpretation of the data and the data that we've developed in my group thus far suggests that using these as prophylaxis rather than therapy, in other words, start it before the radiation therapy begins, use a Lactobacillus containing probiotic rather than a Bifidobacteria species, and use it at an appropriate dose. In other words, don't take too much of this probiotic. I think that the possibility is that this could really, have a significant impact. Just in the United States alone, more than 100,000 patients are diagnosed with GI-related cancers, and many of those will ultimately receive radiation and chemotherapy as part of their therapy. I think the message to cancer teams, as usual, would be that they really need to monitor patients closely and consider involving themselves in clinical trials that can answer these questions. If a patient or a physician decides that recommending a probiotic is something that they want to do, I think again, starting a recognized, reputable probiotic, probably a Lactobacillus species, before therapy and during therapy, and then for the clinician really taking the responsibility of monitoring for potential symptoms. So if patients become leukopenic or if they have low white blood cell counts, that they probably need to hold the probiotic during that period of time to make sure that there's no potential infectious risk. I think in the future, Peter, that we're probably going to be able to identify specific products from these probiotic bacteria and use those products so we don't actually have a live product, but a more purified drug. And that's what's coming down in the future.